Early signs of autism. They make good eye contact and use common gestures, display unusual sensory sensitivities, they avoid or reject physical contact. They don't understand emotions, their own or others, and not recognizing sarcasm or joking. They have aggressive behavior, both with self and others. They imitate facial expressions or sounds by 9 months and plays pretend or make believe by 18 months. They have difficulty understanding or showing understanding or other people's feelings or their own. Major points. It currently has no non-cause or cure. Loss of skills at any time. Not showing items or sharing interests. Not responding to sounds, voices or name. Self-abusive behaviors. Abnormal tone of voice. Persistent preference for solitude. Having unusual reactions. Over or under sensitivity to the way things sound, smell, taste, look or feel. Demonstrate little safety or danger awareness. Have extreme anxiety and phobias as well as unusual phobias. Unusual mood or emotional reactions. Not point at objects or things of interest or demonstrate interest. Have delayed speech and language skills. Get upset by minor changes. Does not respond to name by 12 months of age. Does not understand personal space boundaries. Repeats words or phrases over and over. Does not pretend in play. Does not pretend to feed a doll, for example. Does not understand jokes, sarcasm or teasing. It normally passes by 3 years of age. Symptoms. Some people with ASD also may develop routines that might seem unusual or unnecessary. For example, a person might try to look in every window he or she walks by a building or might always want to watch a video from beginning to end. They have unusual eating and sleeping habits. They also might have abnormal moods or emotional reactions. They might not be afraid of dangerous things, and they could be fearful of harmless objects or events. They might want to have close relationships but not know how. About 40% of kids with autism spectrum disorders don't talk at all, and between 25% and 30% develop some language skills during infancy but then lose them later. Some children with fairly good language skills speak like little adults, failing to pick up on the kid speak that is common with other children. Some children who are on the spectrum that showing signs as young as a few months old. Some children with ASD start talking later in life. They are delayed in learning to speak. They doesn't show concern, for example, empathy for others, unable to make friends or is uninterested in making friends, may have a good root memory, especially for numbers, letters, songs, TV jingles, or a specific topic. May be very sensitive or not sensitive at all to smells, sounds, lights, texture, and touch. Not point to or hold up objects to show people things, show experiences, or show that they want something. For example, they don't point to a dog and look back at you to make sure you have seen it too. Or they drop a toy in your lap and walk away instead of holding it up and looking at you. Not start games like peekaboo or pat a cake.